Hey, Patrick, how you doing, bud?
Not too bad at all, buddy. So, what have you for me today?
We have Jay Bhattacharya on Dad Saves America, and he's going to be discussing some healthcare issues and what it looks like economically in the United States, as
Yeah.
well as Obamacare, the Affordable Care Act, catastrophic insurances, and what's going on with that, and how they're attempting to balance the cost for those insured or uninsured persons in the United States, right?
Yeah.
And uh,
It. What way is it structured in the United States, if you want to let people know? What way is it a 60-40 split between public and private, or is it just 100% private?
Well, this has to do with the SNAP benefits and what it showed as far as the people who are receiving certain kinds of benefits, which starts with the acquisition of a Social Security card. And
Okay.
when we were watching Elon Musk talk to, I think it was Joe Rogan, and he said that if somebody gets a Social Security card, they get access to Affordable Care Act, they get access to Section 8, which is a housing thing, they get access to SNAP, they get access to EBT, food, EBT cash, as well as the WIC program, which are things we talked about a couple episodes
Okay.
ago. So all those things are wrapped up in that, right? So it looks like at this point, it's about 42 million Americans who have access to the Affordable Care. And in
Yeah.
the states like California, New York, places like that, it's even worse because they've issued driver's licenses and these kinds of identifications to people who are not citizens, right? So it
So
gives
you're
them,
saying what people are saying is being massively taken advantage of.
yes, it is.
Okay.
So the Affordable
So
Care Act allowed people to go to, say, like an emergency room
okay.
or for the slightest sniffle, right?
Right.
And then if they could get medication for much less as well. So it said as opposed to paying, I don't know, $800 to go to the emergency room to get your blister taken care of, it would be
Mhm.
$20, and that way you could go in. It wouldn't be that expensive. But the claim was that it would reduce healthcare costs by making things more affordable. What happened was is we started handing out a bunch of free things, and then people went to go get the free things. So
Okay. So what's the solution? So are they going to scrap it?
I don't know what the solution is going to be at the federal level. I'm unsure, but it looks like
Because most of the SNAP benefits, when we were looking at it, like the likes of Alabama, states like that, were the biggest recipients. California wasn't even in the top five when it came to SNAP benefits.
yes and no. It has to do with SNAP benefits for those who are citizens versus those who are not citizens at that point.
Ah, okay, okay,
So
okay.
a higher percentage of citizens per capita in Alabama versus the undocumented illegal alien in California. So literally anyone in California can go to an emergency room and they will be taken care of. It is illegal
Okay.
not to tend to them. You can't say you don't have money, I won't take care of you, right? Like that's not a thing that you can do, right?
Yeah, well,
So
morally, your doctor cannot do that. Their first oath that they take becoming a doctor is they can't cause any harm.
right, the Hippocratic Oath, I get it.
Yes, they
And
have to have, yeah.
in this video, they discuss how this looks in the United States, and they also discuss
Mhm.
how Nationalized Health Service, UK, Ireland, things like that, how they're different, and what
Yeah,
they're trying to achieve as a goal. Right? What is
okay.
the best goal set, and how do we reach that? So
Yeah,
we'll let them cook a little bit.
Our politics and the politicians and the humans that are in and appoint these government experts that have particular monopolistic power relative to just private health med down the street is a bunch of incentives and dynamics that seem poisonous and corrupt and unresponsive to even the most extreme failure we've ever seen in our lifetime. We've had this extreme failure. It's manifestly a failure of policy. The political system seems unresponsive to it. The sort of bureaucratic blob just thinks we're all a bunch of rubes that need to shut up. And that's where we are. So I'm talking to my doctor and trying to get a nuanced conversation. And my doctor faces this whole other ecosystem of medical liability and Obamacare regs and what they might be getting paid for recommending or not. And Is there any path away from such a government-controlled healthcare system, in your view? Do you see, as a policy expert, a path towards less government? You talked about decentralization, but to actually get politics out of my doctor's office, is there hope for that? It feels like this should be the biggest thing being talked about post-COVID, and yet I don't see it talked about anywhere. Like, get the government out of my doctor's office.
I mean, I wrote a health economics textbook. Actually, kind of, it's if you read it, you wouldn't say it's exactly on that theme, but it was actually on that theme. The question is, why are governments involved in healthcare at all? And there's an economic answer to that. So the economic answer is that there are a deep range of uncertainties about our health, some of which require tremendous amounts of money to deal with. Right? I get cancer. If you just ask me to pay out of pocket for the treatments of some of the really rare cancers,
right? They're absolutely insanely expensive. They're insanely expensive to handle. So the attempt to bridge the gap by having everyone pay into a system like a single payer, like, which we can't afford, right? A single payer. If I get a rare cancer, it will be millions of American petrodollars to pay for that thing. I don't have millions of American petrodollars to pay for these things, right?
But you also have to admit that most of the healthcare costs in America are about 10, 15 times higher than most of the G7 countries, even the G20 countries.
Right. No, and it's gotten worse since the Affordable Care Act.
Crazy.
It's gotten worse since the Affordable Care Act too, significantly.
Yeah, it has.
So before the Affordable Care Act, my health insurance was at X dollars, and now it is at Y dollars, roughly 3.5 times the cost.
Okay.
And I receive less benefit for the money. Right.
Right.
So a basic family of 4 or 5 is going to end up paying over 2,000 American dollars for health insurance for their family. Whereas before the Affordable Care Act,
that's a monthly payment, just let people know.
Monthly payment, yes, close to $2,000. And I'm not even talking about COBRA, which is if you're working and you're getting health insurance from your employer, and then you go, for whatever reason, you just change jobs, you can go on a COBRA benefit, which is you pay an exorbitant amount of money because you're paying not only the cost that you had, but you're paying the employer's cost to maintain that insurance, right? So it gets even worse with a COBRA benefit, right? It's just bad, right? So if you have American families of, say, 4 or 5, mom, dad, couple or 3 kids, it is insanely expensive on top of
and what's there, say if these people cannot afford that premium, what alternative is there in the United States for them?
Well, it's based on income, but that income doesn't necessarily take into account your childcare costs or what it costs to pay for your vehicle. Understanding that you're going to pay more for a vehicle that can actually put child seats in them, right? Because there's legal requirements, right? So there's a bunch of hidden costs, right? So if I make X amount of dollars and I'm over the threshold, then I must pay for insurance outside. But if I make less than a certain amount, then I will get insurance for free. I will pay nothing and get insurance. But now that means that all the people who are paying for insurance are going to have to pay more, because now there are more people receiving the benefit that have not contributed to the system, right? So, yeah, not great. Let's let them cook a little more.
Okay.
I'm not going to have enough money to pay for it, and so I need to get insurance. There's the technical term is that the distribution of medical expenditures is right skewed, right? There's a tail of expenditures that is that it's low probability but very, very expensive. And if you get it, you want to have insurance to cover it, because you're going to even if you go bankrupt, you're not going to be able to cover it. A young, healthy young man has no desire to pool with me in health insurance, because if I get sick, he'll end up paying for it, and he's much less likely to get sick. And so the insurance markets tend to do poorly in providing coverage for those rare outcomes, but that's exactly what that costs money in a expensive healthcare system. There's another.
The other thing with that was, with the Affordable Care Act, you had to get insurance. You didn't have a choice. It was mandated. And what Obama called it was a penalty, not a tax. So the Supreme Court has recently ruled that that is a penalty is a tax. You're being taxed if you don't get insurance, but you shouldn't be forced to go on the market to buy a thing you don't want. Right?
What is it? But not if they get sick without insurance, what happens to them?
Then they go bankrupt.
They go bankrupt. Okay.
Yeah, that's the option. That's the risk that you take. Right?
So there's no social kind of safety net there for people who genuinely can't afford it.
There's a social safety net for those who don't meet the financial threshold. And the financial threshold was changed. And then there was also a penalty. So when I file taxes in the United States for my federal taxes, I have to show on a document that I was medically insured for the year, right? For the calendar year from 1 January to December 31st. If not, I'm assessed a penalty, which is functionally a tax. I get taxed for not doing a thing, right?
Okay.
So they kept trying to compare it to auto insurance, right? So it is a privilege, not a right, to operate a vehicle, right? Like anywhere. So you need to get a driver's license that shows that you can safely operate a vehicle.
You get tax insurance and so on, all that kind of thing.
And then you need to get some kind of liability insurance to ensure that if something happens and you're at fault, then the other party can recover medical costs and the cost for repairing the vehicle, Right? But you don't have to own a vehicle.
But what happens if a person says homeless or so on? Do they get medical treatment?
Yes, they do, because they don't meet the financial threshold. But the financial threshold has changed, and that penalty, which is actually a tax, which the Supreme Court ruled is a tax, you can't force someone into that situation, which is why it's coming up now.
Yeah.
Like big time.
But so. I see with this bill now, they're talking about that the fact that your premiums from January 1st onwards will go up between 10-20% across the board for everyone. How do you think that will affect people's opinion of this bill?
If it does in fact go up, then that's a bit of a problem.
Well, no, the insurance companies have said it will.
Well, the insurance companies are for-profit entities, right? So they're going to do what they need to do for profit. But if you understand, because of Citizens United, those big pharma companies and insurance companies have apparently a First Amendment right to generate super PACs and give politicians money, but they can't say, here's what it's for, right? So if I give somebody the brown envelope and say, this is from us and we're the widget lobby, obviously they're going to want advantage on widget production and less restrictions on the widgets, right?
But how do you think this bill, say if people's premiums do go up, do you think this will affect the next round, as they say?
Oh, for sure.
Of elections?
For sure it will. But the problem is we have two-party systems. We have a two-party system here where the other side is always wrong, and they're not attempting to collaborate. Right? They're not working together to achieve goals. They're trying to get all the power on their side. Doesn't matter whichever side, and they're pushing their policies through. And then if there isn't laws passed by Congress, then they're just erasing all of the executive orders from the previous executive. Right?
That's what it seems like. No matter what any other president brought in before this time is being taken out because it might have their name attached to it.
Right, which makes it obviously wrong because you've othered them.
Apparently has his own plan in the works, which he said last time too, but
yes.
It'd be interesting to see how this will affect the next primaries if this does happen. For sure.
And midterms and all those other things. So, all right.
Yeah.
Here we go.
Another problem, which is that if I do have that insurance, I'm going to go get stuff that I probably don't need because it's relatively inexpensive to me.
So this is moral hazard, right?
Moral hazard, exactly.
Oh,
so these
I'm covered. I'll take two.
Exactly. So you have these but at the same time, if you have the government do it, right? If you have the British NHS, the government just pays everything, $0 at the point of service. You're going to have the moral hazard problem in spades. You're going to have,
because everything's free, so I'll take two. It's like when Obamacare. I remember there was this Oregon study in the about Medicaid and Medicaid expansion, if I remember this correctly. This is going back a little bit, so correct me if I'm screwing this up. But the study in the aftermath of Obamacare, which expanded Medicaid coverage And thereby, for those who got on Medicaid, they could go to the ER and not get a bill or not get a substantial bill like they used to.
Right. We talked about that before. So
Yeah.
now with every sniffle and blister I have, I go to the ER, right? As opposed to whatever other method I am going to use, right? Like wait a couple days to see if the sniffle goes away. Nope. Right when I get the sniffle, I'm going to go right in right away. Right.
Okay.
And it serves two purposes. One, it's going to validate whatever I'm saying is the case. And then I'm going to get the care. They can't refuse the care. And then they're going to have to spread how they get paid because hospitals are for profit. Big pharma is for profit. Insurance is for profit. So they're going to have to attempt to get their profit somehow. And that gets passed on to those who are actually paying monthly premiums for an insurance policy.
Well, yeah, but in every system, you're going to have people like that who will take advantage. No matter how carefully you try to build a system, you're always going to have a certain amount of leakage and people taking advantage of it.
Oh, for sure, for sure.
But if you throw out the entire system, it's going to hurt a lot of people who are innocent in the whole scenario.
Life is rough. I mean, what are we going to do? If
Yeah, but I'm talking about the elderly and the very young that
Of
are
course.
covered by mostly covered by Medicaid. Well,
Correct.
now Obamacare or whatever you want to call it.
Mhm.
They're even showing numbers. Most of the people on this are the elderly and the very young.
Right. Well, then it has to do with the aging of our G20 countries and the low birth rates.
Yeah.
Right. That's also a factor that plays into this. Right. And like you've told me before, your country, they're getting bigger. We're getting bigger, and not in a good way. Right. That we're not doing ourselves any favors, honestly. Not exercising, no good diet, getting on all kinds of medications early, and with all kinds of predatory policies and things like that. It's just not great.
But even if you look at the G7 countries, the most unhealthiest country is the United States.
That's a
When it
fact.
comes to obesity and diabetes and every metric you could possibly use.
Yep.
If
for
any
sure.
country should have affordable healthcare, it would be the United States because they genuinely need it, by the sounds of it.
Looking that way. It's looking that way.
Which sounds great. Oh, you're a working class or poor person. You got to go to the emergency room because you're sick, and now you won't get a bankrupting bill. Okay, well, the claim was somehow that this would reduce the utilization of ERs. Why making a thing free instead of expensive would reduce its use is maybe because there's not enough PhDs in economics and health policy. But of course, that's not what happened.
Yeah, that math doesn't math at all. It doesn't, right? If I have to pay X amount of dollars for something, then I have to weigh how important it is I go do the thing. If I can just go do it, right, and there is no cost to me, there's no consequence for abusing a system, then again, you reach moral hazard, right?
Yeah, but you also have to admit that the medications, even the doctor visits in the United States, are some of the highest in the G7.
Yes.
It's unbelievable, even when it comes to insulin.
Right. So
It's the most expensive country.
right.
When it comes to any form of life-caring medications, their prices are unbelievable. Like they wouldn't be allowed anywhere. The prices they charge wouldn't be allowed anywhere.
Right. Well, that has to do with for-profit plus lobbyists plus super PACs.
Yeah.
Right. So it's not.
That's what I'm trying to say is they have to come up with a proper system. I understand that every system has a problem. The United States has to sit down and look at itself in the mirror and say, we really have to start dealing with these lobbyists and these healthcare companies because their practices are unbelievable. They have to be regulated.
Again, it's Citizens United. And I doubt that it will ever become overturned because the people who have the money now have the power to dictate what that looks like. Right?
Yeah.
It's the brown envelope problem. Here's a brown envelope. Wink, wink, nudge, nudge. Let's do it our way, right? I want my widgets to be unrestricted, and I want to be able to push them anywhere and do whatever I want, and I want to get all kinds of advantage. And these politicians are not really doing what they're doing for their own constituency. Like, what do the people in my constituency need? What they're doing is they're saying, this is what other people who have indicated they desire and have given me the brown envelope want. And because of Citizens United, they can do that. It's
unbelievable. Yeah. It's crazy. And the fact that the sad thing is, it's mainly from the Republican side and mostly Democratic side, none of them want to talk about the main issue of the healthcare companies and the healthcare industry in the United States. There's absolutely price gouging them.
Right. Well, you vote with your
They're
paycheck.
blaming everyone. They're blaming everyone. They blame the poor people. They blame the immigrants.
Right. Oh, for
They
sure.
won't blame the company that's actually on their backs. They won't mention the elephant in the room.
Right. Well, you vote your paycheck, right? Whatever's going to be the most advantageous for you to earn the money you earn and then gain the most advantage in the system.
Yeah.
Right. That's why in the United States, rich pensioners are the winners right now. Right. And then anybody who has like a union based job, they're always going to vote what makes my union stronger. Right. Like,
yes.
And if you're poor and you can vote, you're going to vote for the thing that advantages you the most. How do I pay less while stuck in this poverty trap?
And that's why a lot of people voted for Trump this time around, and a lot of Republicans.
Yes.
The reason why they gave him the mandate is because they promised affordable health care and promised all this. And the first thing they do is put a bill through that is going through the Senate right now. It looks like it's going to pass. That is going to literally add another 10 to 20% onto their premiums.
That's apparently the way things work. And a lot of that has to do with lobbyists and Citizens United.
Yeah.
So,
yeah.
Let's get back to it.
People that got on Medicaid use the ER a lot more. And the Oregon study found that actually those people didn't even end up with better health outcomes than those who didn't get on the Medicaid. And instead of going to the expensive ER and have taxpayers pay for it, they did other stuff, which also got them better. And so that study to me represents.
I don't like that vague other stuff thing right there. Like, I would like to know what that other stuff is. I understand what he's saying is that there's people on Medicaid who went to the ER and they did get better. Right. But the thing is I think it's more they waited a few days for the sniffles, or they waited until the situation exacerbated and then went to the ER. Right. We waited a few days, and now people are not waiting a few days. Right. And in not waiting for a few days, they have gummed up the system because they've gone in for the sniffle and the blister as opposed to the broken arm or some other medical thing that does in fact require immediate attention from medical professionals. Right.
Yeah.
A pretty robust counter to this theoretical claim that, insurance markets can't work because of all these information asymmetries and blah, blah, blah. Government failure seems like it swamps market failure every day of the week and twice on Sunday. So I know I'm being super ideological here, but I'm also not, because I think that's what happened.
So what he's talking about is the market dictating prices. The problem is because there are catastrophic health issues and you can't know. And even if there is an actuarial table that shows these are the kinds of things that happen, when it happens to you, it's always a black swan, right?
Yes.
You don't know that the bad thing is going to happen. But insuring against these catastrophic things is what is costing the money. Like, so you, me, and a young man, right? So you and I, our health costs are going to end up being higher for a thing that happens. And the young fella, unless it's a black swan event, something comes straight out of the sky and gets him,
exactly.
Right? Then all three of us are paying the same. But the likelihood that the young man is going to need the medical attention that we may require at our age is different, right?
I think what's wrong with people is they don't want to pay for their neighbor.
Yeah.
They want, and that's pretty much what it comes down to, a lot of it in society. Right. But we're all going to get sick at some point in our lives. No matter how healthy you are, or you could be a world athlete, you're going to get sick sometime in your life.
Right.
The problem is everyone thinks that they shouldn't pay for the other person getting sick, which it pretty much comes down to. Nobody wants to put into the pot to cover someone down the road.
Right.
Because they're not sick themselves.
Yep. That makes sense. But that's why Bernie Sanders' single payer thing is also not going to work, because single payer requires someone to make money that they don't have to support a thing they can't now support financially.
Yes, and Bernie's system, Bernie's system is not going to work either.
No.
But what would be decent is if they put in a proper means tested system, and anyone in Ireland will understand what I mean by means test. When a means test is done, say for any kind of social benefit, they take your wages, they minus all your expenses like your mortgage or rent, your bins, your childcare, and the whole lot, and whatever's left at the end is what is your income then that you're judged on.
So it's your disposable income. Yes.
Income is what affects your social benefits,
Right.
not actually your total income. In some cases, well, I know third level grants are different, but I'm talking about medical card, social welfare, and so on. I think what the United States needs to come up with is a system like that, where say if you make 50,000 a year, but your expenses are 40, your real world income is only 10.
Right.
So
Disposable income is 10 grand.
Yeah.
Yes.
Or then you qualify for X, Y, and Z.
Right. That
I
makes
know
sense.
there'd be a lot more paperwork and there'd be a lot more administration involved in it, but that'd be a fairer type of system.
Well, for sure. Then you could actually assess what would be a reasonable amount of charge people, so they're not dunked like the families that are ended up paying $2,000 a month for insurance.
But the sad thing is, I would never see a system like that ever being brought into the United States, because all they have to do is put the word socialism in front of that, and that'd be it. And everyone would be quiet about it. That's a socialist idea. That's a socialist idea, and that's it. And you're back to square one again.
Yeah, that's. And then you put the government in charge of doing that test, and I don't know how that's going to look, because the government's real good at,
Actually, the one part that actually shocked me during COVID was how underprepared your social welfare system was across a lot of the states. When a lot of people got laid off all at once.
Oh yeah,
their entire systems was crashed.
Yeah, boom.
And there was one state, I can't remember the state, but their whole social welfare system, this state now, I think it was 50 or 60 million, something crazy anyway. Large enough state. Can't remember what it was, but their entire social welfare system office only had 100 and something people.
Oh God.
The whole state.
That sounds like Kansas.
Yeah, I think it was something like that anyway. But it just crashed, because the problem is a lot of people in the States, I presume you agree with me, have the social stigma of looking for help off the state.
Yes, for sure. If you're not a producer, you're not good. If you don't produce and make, then you're bad. So, all right, let's get back to it.
Make the argument. Argue against that.
There's two ways to view this. Your view was that it's a failure of government because it's government insurance. Another way to view it is that the medical care system, what it provides is not primarily prevention of death. It's providing something else. Financial peace of mind, the idea that if you're sick,
right, the financial peace of mind that if I get a $50,000 bill from the doctor, I'm only paying some very small percentage because insurance is covering it, right?
You pay some sort of form of copay, isn't it?
Right, it's a copay. So you'll end up with we'll say a minor surgery that costs $7,000 or $8,000. You don't have $7,000 or $8,000, but you're paying, $500 or $600 a month for your health insurance, and it covers those things. You pay for the office visit X dollars, and then you pay a very small percentage, right? Dictated by the insurance company to the hospital, right?
Yes.
Yeah, it's very, very strange. So they're like, well, you charge $20,000, we're only going to let you charge $13,000, and then we're going to pay $12,800 of that, and then $200 is left on the patient, right? That kind of thing. It looks very strange on a bill. So, all right, here we go.
some smart person's, some kind smart person's going to look after you and think about you. It's providing something else, at least in the United States, beyond just the prevention of death. You mentioned the problem of government provision of health. Like the NHS is a good example. The UK NHS is a good example of this. Right there, you have this moral hazard problem that we just talked about. You have this problem that you pay nothing at the point of service, and so people will want to line up for all the services. They solve that moral hazard problem, if solve is the right word, by queues, by asking people to wait to get care that in the United States, if you have insurance, you'd say, why would I want to wait 6 months to get, cardiac catheterization to clear a clot in my heart?
Is what he's saying true about the National Health Service there? Okay.
I'm in Ireland. I'm talking about our National Health Service.
Mm-hmm.
Yeah, we do have a queue system.
Right.
So anyone whose urgents are obviously seen within a week. Anyone who's not, then is the middle rank and so on and so forth. Yeah, there is a queue system. Yes.
Right. In the UK, that happens. And actually in the post-COVID era, it happens all the time. Fundamentally, this is just my philosophy. I think that there is no utopia. That cannot be. That there are these like deep uncertainties, and neither governments nor markets can automatically solve them. Markets sometimes solve them really well. I mean, I tend to think that as an economist.
Right. There's going to have to be a melding of those two systems, like you were saying, to get an optimum return. Understanding that there's going to be waste and fraud and issues and problems, right?
But as I said, no matter how perfect you're going to build a system, there's always going to be people taking advantage of it.
Right, of course.
But you have to accept that for the greater good of your society in some way.
Well, the greater good is interesting.
But the problem is throwing out the baby with the bathwater, which they look like they're trying to do it here.
Not great.
It's not great, especially when you have a very deeply unhealthy population in a lot of ways. And they'll have to have, as I was saying, a meld of maybe a bit of our system and a bit of your system, and see what they can come up with properly. Get proper people in charge.
That doesn't break the American family. Yeah, that doesn't break the American family's budget.
Yes.
And I think the disposable income version that you were discussing, the means test, would be a great way to do that.
It is. And a lot of G7 countries do it. A lot of G20 countries do means testing that way.
Right.
But I think the problem is, by the way, America is not just unique in this. Canada is very much like yourselves now when it comes to the health service.
Right.
Is they're looking at people's total household income at the start, but not at the end after all expenses.
Right, for sure.
And that's a really, really bad way of doing it. Because people might have 100,000 a year, but their outgoings could be 90. Right. They could have, they could have very little left by the time food, rent, everything's paid. So they won't have money to get the healthcare. So they're just going to roll the dice from month to month.
And most Americans can't even handle a $400 to $1,000 issue if it comes up. If there's your water heater went out, you need to spend $910 to get the thing. I can't afford the thing.
You can't afford it.
Yeah.
Like I watch a lot of Dave Ramsey, and it's still shocking to him. I was listening to him recently in an interview. He said people have got better, but it's still the same statistics when he started. Now, is most Americans have less than $1,000 in their bank checking account right now.
Correct. Yeah, they do. And then
these are the people, by the way, who voted in these politicians to help them with that, lower their bills, take the monkey off their back in some way.
Right.
But now, thanks to this bill and other bills that look like to come down the line, we're going to end up paying more next year than they did this year across the board.
Sure. Yep.
It's crazy.
We can see it coming. Here we go.
And governments can certainly always often screw up, but markets do have problems, and governments do have problems, and we're always going to be muddling through. Is my philosophy of the way the world works.
So that's, like you were saying before, a greater good issue. We need to do this as best we can for the greater good.
Yeah. Like, you have to help your fellow man in some way.
Oh, for sure.
you have to. It's just, we're part of society, or we're not. Right, and you have to start thinking about other people. And I find that, especially in the Western world, we're become very insular as people ourselves.
Oh,
we're very unwilling to help our neighbors.
Well, we're not going outside and touching grass. We're not going outside and interacting with our communities.
No,
we're just not.
We're very disconnected, and we're swallowing a lot of stuff that, even if you sit down and do a small bit of common sense and look at it, it's a big load of BS.
Yeah, it's bollocks, my friend. It's bollocks.
Yeah, well, yeah. and the way I see it when it comes to healthcare is, we're all going to get old. There's no way of putting it. That's just the nature of life. We're all going to get old. We're all going to get sick sometime in our life.
Yeah.
The sad thing is, it's a bad judgment of society if we're going to allow our very elderly and our very young to die on the side of the road, while the wealthier get richer and richer. Yeah. It's a really damning part of society.
Yeah, that's a fact. So, All right, we're going to be closing this one off. Do you have anything to add there, Mr.
Oh no,
McCollum?
I know people in the comments are going to say, "Oh, he's very socialist." No, I'm not. It's common sense.
All right, for Patrick McCallum, I am Alex Johansson. Please ring the bell, like, subscribe, and help us beat the algorithm. We are out.